I'm Caitlin Ensley, Senior Director of Education and Outreach at the Mental Health Association of East Tennessee, where we work every day to promote positive mental health and improve overall well-being of youth. For 25 years, Mental Health 101 has been changing lives, educating students, decreasing stigma, and empowering young people to speak up and seek help. Let's hear from some of the incredible educators that bring Mental Health 101 into classrooms.
Mental Health 101 is so important for schools and for students because it really does lay the framework and the foundation about what mental health is. Being our thoughts, feelings, and behaviors, it really does give students the tangible resources and the knowledge to know what coping skills are, how they can deal with what they're dealing with in everyday life. So it really does help them with the challenges that they're facing every single day. What motivates me as a mental health educator is I have the best job in the world. I get to work with middle school and high school students every day and talk to them about mental health. I get to work with the best teachers and students in the area and help them with developing coping skills and talk to them about knowledge and tools and resources that really help them with their everyday lives.
Mental Health 101 has been visiting my middle school health classroom for over 15 years. And the impact that this program has had on so many students across Knox County schools has been immeasurable. And so mental health really ties in that being emotionally, socially present in school and outside of school. Students learn the tools that they need in order to cope with everyday challenges and in order to learn exactly who they are and who they want to be.
I think Mental Health 101 is important to students because it's a program that everyone needs. It's something that a lot of people don't get access to. A lot of older generations and people even my age just don't have. They don't have the fundamental understanding of what mental health is and why it's important. So getting that program to these students, providing them the basic understanding of what their emotions are and why they feel them and how to deal with them when they're overwhelming is super important. I think coping skills are something that you could go to college for. It's something that I went to college for. So providing that to these young minds and giving them the skills to navigate the rest of their life at such a young age is just absolutely critical. And it's something that I wish I had, and I think that's where the passion comes from.
A goal that I have for this school year is to make more individual connections. I always like to leave time at the end of classes for students to be able to have one-on-one connections with me. I find that this time is a good time for them to express their thoughts, ask specific questions, tell me about their specific struggles, and it really helps me understand their exact needs. If I had a program like this in school, I would have really benefited from it. And I challenge everyone to think back to your teenage years. When you were a teenager, would you have benefited from a Mental Health 101 program? Because I know I would have.
Mental Health 101 is an early intervention program designed for middle and high school students across Tennessee. Each year, our dedicated staff visits more than 120 schools, reaching over 25,000 students. In 25 years, we've served more than 400,000 students, each one learning how to recognize signs of mental illness, understand depression and anxiety, and how to get help. Why does this matter? Because 50% of all mental health conditions begin by age 14. Early symptoms can be confusing, appearing and disappearing, leaving young people unsure if what they're feeling is real. Many wait over a decade to seek help, making them vulnerable to greater impairment and lifelong challenges. Mental Health 101 changes that. It helps teens recognize when they or someone they love needs help and motivates them to speak up. We believe in the power of early education, in supporting parents and professionals, and in building resilience through knowledge, advocacy, and self-care.
I have had a lot of heartfelt moments since I've been with the Mental Health Association, but the moments that truly resonate with me and stick with me are when the students come up to me after class and you can just see that they have gratitude in their eyes. And when they say, I needed this today, it is really impactful and it really reminds me of how powerful this program is.
There was once that I went to a school and I was having a particularly off day myself. I just wasn't really excited. It wasn't the best day for me, but I knew that what I was doing was important. So I gave it my all. I did the best that I could, and I didn't feel great about it. But at the end of the day, a student who had been watching me very intently, I had noticed his intention. He came to me and he didn't say a word. He just passed me a little slip of paper. It was about this big. And I said thank you, and he left. He never said a word to me, but I opened that piece of paper and it said thank you for what you're doing. And that to me was just, I mean, it was so emotional. It wasn't much. It's not like he gave me a speech. It's not like he wrote me an entire note. It was just a little thank you for providing that absolutely critical information. And I actually put that piece of paper in a frame, and it's still in my office to this day.
I have so many heartfelt moments from being in this role, getting to go to all these different schools in the area. One particular moment was a student that came up and said, you know what, you really helped me put words to what I was feeling. I knew I was dealing with some anxiety, but I really couldn't put the words together and make the sentences work. And so I had a student draw a picture for me. Apparently I thought they were just doodling in class, but they were really drawing a picture for me. I still have that picture of that little hummingbird that the student gave to me after class, and it was really a sweet, sweet moment. That was a really heartfelt moment for me.
Our team is passionate about holistic mental health and empowering youth through education and skill building. Whether it's teaching coping strategies, promoting self-care, or simply being a trusted adult in the room, Mental Health 101 is helping kids every day. We are grateful for the opportunity to connect with students, guide them on their mental health journey, and help them reach their fullest potential. The more people know about Mental Health 101, the more students get the program. And the more students get the program, the better equipped they are to deal with the stressful situations that they encounter throughout their life. And if everybody is equipped to deal with those stressful situations, they can help themselves, they can help their friends, they can help their family members, and that's all we really need, right, is helping each other.
Mental Health 101 has come a long way, but there's still so much more to do. You can help us continue this vital work. Whether you're a parent, educator, community leader, or simply someone who cares, you can be a part of the movement to support youth mental health. Together, we can change the conversation. Together, we can save lives. Thank you for celebrating 25 years with us.